used to have a lot of thirst. I saw I could just take soda instead of taking water. I didn't know that I had it. But after some time, I said, let me check, because my mother had that problem.
She was 51 then, and her instinct to get checked back in 1999 opened her eyes to the fact that she had diabetes mellitus too, just like her mother. Stephania Sempa, now aged 63, has been living with this condition for 12 years now and on drugs. She cannot afford to sleep and skip a day without taking her medicine, and every 30 minutes she has to drink a bottle of water due to burning thirst.
People couldn't understand why I was taking it, but for me, my doctor told me.
There is a hormone called insulin. When you eat food, the pancreas releases the insulin to break down and absorb glucose, amino acids, and fatty acids.
Diabetes 2, or an insulin-dependent diabetes mellitus, is a chronic non-communicable disease which occurs when inadequate insulin is produced or the body cannot recognize what is produced. When there is such insulin resistance, the body makes excess insulin, but the muscle, liver and fat cells that need it do not use or respond properly to it. People become susceptible to this condition as they grow older, usually after the age of 40. But diabetes type 2 is increasingly being seen in younger overweight people. According to the World Health Organization (WHO), diabetes mellitus 2 is the commonest type, manifesting in 90% of people worldwide. The International Diabetes Federation estimates that in the next 2 decades, 1 in every 10 people will be diabetic, and the numbers could increase from 346 million to 552 million if no preventive measures are adopted. The causes of diabetes are numerous, but the commonest are obesity and lack of physical activity. Health, diet and regular exercise are the first-line treatment, so to speak. Oral medication and insulin are necessary for mitigation.
That is the most important thing also. On top of that, medicine, you have to take take a lot of green vegetables. That one must be, is a must on your diet. So you have to make sure. But that time, I got fed up of it at one time, and then it went up.
The diet, the foods that we eat contains lectins. Some of those lectins are not compatible to our blood group and genotypes. Some of them go into the pancreas and interfere with the production of insulin with the beta cells, and they bring insulin which the body cannot use.
The symptoms of type 2 diabetes tend to develop gradually over time, and because of this slowness, you may not know you have the condition, and some health workers may fail to diagnose it. The symptoms include frequent fatigue, numbness in the feet, itchy skin, especially in the groin area, erectile dysfunction, and bruises or sores that heal slowly. Others are recurrent bladder infections, kidney failure, increased urination, blood vision, increased thirst and hunger.
The reason to urinate frequently is none other than you have a lot of sugar now in the body system, in the blood system, and the insulin is not there to do the regulatory work. The more you urinate, the more you feel thirsty. Okay? So every time you'll be drinking. And because you are drinking, a lot of mineral salts and food nutrients are withdrawn from your body. And that leads you to frequent hunger.
The more you eat, the more you expose yourself to obesity. Some diabetes 2 risk factors include a family history of diabetes, high blood pressure, past history of gestational diabetes in pregnant women, those over 40 years, and when you lead an inactive or sedentary lifestyle. Medical experts say what is worth noticing about diabetes 2 is that it is preventable or can be delayed. Eating healthy, stopping or avoiding tobacco use, doing physical exercise for at least 30 minutes for 5 times a week, maintaining a healthy weight, and testing for prediabetes are measures that will keep the doctor away and definitely guarantee you a healthy life. Florence Nalimba, NTV.